Whether you're a Republican or Democrat or independent, you all need health care, and most likely you feel you pay way too much for it. But Obamacare is only partly to blame. Haley Wilgus explains.
The reason we saw a price increase in many plans when the Affordable Care Act first went into effect is because they were required to carry certain services like maternity care and mental health care, and the big one, people with pre-existing conditions. So why now are we seeing more increases? In some cases, triple-digit percentage increases. Well, it all comes down to uncertainty and lack of competition.
We were able to find information on the plans that are being released here for 2018.
J.S. Gagnon is starting to review health insurance rates for his clients for the upcoming coverage year. And once again, they're rising.
In 2017, the average premium was $525 per month. For 2018, it's going to be $725 per month, which is a 38.1% increase.
Gagnon is the CEO of ClickMyQuote.com in Sarasota. As an agent, he helps individuals, families, and small and medium-sized businesses find the right health insurance plans. He's seen major changes since Obamacare first went into effect.
When we started in 2014 writing Affordable Care Act policies, there was probably 8, 9, maybe even 10 carriers per county. So there was a lot of options, there was a lot of competition. Unfortunately now, here in Sarasota County, we're only going to have 2 carriers to choose from this year.
In some markets across the country, it's a monopoly situation.
A lot of counties in the United States have 1 carrier to choose from, so those carriers can do whatever they want.
And that usually means increasing rates substantially. But lack of competition isn't the only thing driving up the cost. There is great uncertainty for insurance companies with the healthcare gridlock in Washington.
Nobody knows what's going to happen, so the insurance companies right now are looking at this and they're saying we have no predictability as far as what to expect over the next coming years.
Gagnon says insurance companies fear the Trump administration is going to do away with cost share reduction payments. Those are currently paid by the federal government to insurance companies to make up the cost of providing subsidized plans to low and moderate income customers.
A lot of the insurance companies are saying, you know what, we're going to increase the rates a lot just to cover ourselves. The last thing we want to do is lose money, so we want to make sure we don't lose money.
So who loses are American families, especially those who don't qualify for federal subsidies. Gagnon says that applies to about 500,000 Floridians.
And when you tell a family that they have to pay $1,500 a month for a $14,000 deductible, it's not right. It's just not right.
Over the coming year, we could see more market failures where markets collapse, insurance companies pull out, and then for the unlucky people that live in that area or that state, they'll have escalating, skyrocketing costs.
Cost is the major issue, but people are also having problems getting through the system and finding the right plan. As New College of Florida political science professor Frank Alcock explains, why would the White House pump money into a program it wants to repeal?
It's almost a starvation tactic on the part of the federal government. They do not want to invest in a system including simply the websites and the navigators for helping people buy packages, healthcare plans on a market that the federal government, Trump administration, wants to get rid of.
Without the Republican votes needed, that doesn't seem imminent. So Gagnon says you might want to consider a non-qualified health plan. Even though you will have to pay the tax penalty, you still might end up on top.
In a lot of cases, the plan is so much more affordable, these are more catastrophic type plans, that the cost of that premium and the tax penalty is still less than buying health insurance through the exchange.
It's all about finding what's best for your physical and financial health. Haley Wilgus, ABC 7, your Suncoast News.